The advantage of having a dietitian is the dietitian can spend some time with the patient, help them to understand their illness, help them to take steps to modify their lifestyle, particularly when it comes to talking to people about how they eat and their activity level. People can feel very, threatened by that. And our dietitian has done so well that patients want to come back and see her.
So I'll look and see who I pre-screened and then see who's here. And then while they're waiting for their provider, I'll go in and introduce myself if we've never met and check in, see if there are any health goals they're working on, see if they have questions, maybe even go over some labs if they haven't been explained as enough for patients to really understand them.
Our dietitians are running around all of the time between hallways so that they can provide care for all of our patients. And there are days that it is very busy. And even if there isn't a lot of time to spend with the patient, the dietitian has been able to find the right resources that the patient needs and can give them something tangible to review and to look at and schedule a follow-up if needed. And so allowing that flexibility has been great for our patient population.
I'll have providers either before the appointment or after appointment sometimes come in and get me and say, their blood sugars went up. Could you pop in after we've talked? So they have more time to focus on medications or other healthcare issues or checking other things, and they don't have to worry about their food, their diet, their nutrition. Someone's addressing that.
We have adopted a team approach to care, particularly with chronic disease and chronic diseases such as diabetes, high blood pressure, obesity. And with these diseases, as a physician, there are certain things that I can help people with. I can give them insight into their condition. I can prescribe medications, for example, for high blood pressure, diabetes, but that's only really part of what patients need. Patients need to learn how to modify their lifestyles, optimize their diets, their activity levels, and so on, which is really probably ultimately the most important part of their care.
We love our dietitians very much. I do not think that I personally could ever work without a dietitian on the care team, now that it's become very much a routine in how we provide care as a care team. Dietitians are a critical part of that for our patients, both for treating chronic illness, but also in prevention, which is really our goal.